session. So, namaste everyone. Thank you for being here with us on Karunamayi Holistic platform for the Ayurveda webinar today with Dr. Dhanwantri Jha. I would like to give a small introduction of Dr. Jha. He is not only an MD doctor in Ayurveda, but he is very unique in his wisdom because he also possesses a background in modern medicine, as he carries an MBBS medical degree as well from China. From Hebei Medical University in China, and then after that he explored Ayurveda and he turned towards Ayurveda and got his MD in Ayurveda. He also has a post-graduation in Ayurveda ophthalmology, and he is a winner of the National Health Award from National Academy of Ayurveda, and we are very, very fortunate to have Dr. Jha here with us today on our platform to share about Panchakarma, which is an ancient healing and detox technique which has helped people in various diseases that I personally know myself, actually, without Dr. Jha telling us about it also. Like, I know several people who have even got help in chronic ailments like liver cirrhosis and all through going through the ritual of Panchakarma. Along with their allopathic treatment, and they were able to wean off their allopathic treatment by slowly following through Ayurvedic treatment. And so Panchakarma is a very, very ancient healing detox method, and Dr. Jha has a great level of expertise in that. He also conducts retreats in Panchakarma. So that's also a very nice thing for us to know if we ever plan to go for a retreat for Ayurveda for Panchakarma. Just to let you know, I'm myself getting Panchakarma right now, and I know how awesome it is when it comes to the amount of like oil massages and Shirodhara, like how it makes you totally peaceful, calm, and improves your digestion as well to an extent, but it's a process and I have to go through it for the whole month. I've just started it, but I'm feeling a difference already. So I welcome Dr. Dhanwantri Jha for explaining to us more about Panchakarma. Just as a short note, this webinar is not to give any specific medical advice to your own personal health condition. Please do consult your physician for that if you have any health condition. You are welcome to ask Dr. Jha any general questions regarding Ayurveda and how it relates to the health. But Ayurveda is very specific to every person and their body type, their nature, and that needs a close evaluation of the person, which cannot be done on this session. So this session will not we will not be giving any direct medical advice. Just a general question and answer sessions will take place at the end. So I will now put Dr. Jha on the spotlight so he can start sharing with us about Panchakarma and what it is all about. So the audience who have no idea will now learn about this amazing healing detox method.
Thank you so much, Gauriji. It's wonderful to be with Karunamayi Holistic. And as I was talking about Karunamayi Holistic is working excellently for bringing up the Indian systems of medicine and specifically other systems of science, basically, which originated from India, and introducing it to North America. I would say I would like to thank them for this wonderful thing, and really a pleasure to be here. Always a pleasure to work for Ayurveda, spread Ayurveda, and teach Ayurveda to people. Namaste, I'm Dr. Dhanwantri Jha, and let's learn a bit about Panchakarma, the mystique or the magical treatments of Ayurveda that we often listen about, we know a bit about, but we don't exactly understand how it works, right? So let's see how it works, on what it works. I'll share my screen and my presentation on Panchakarma. I would like to start this with a prayer to Lord Dhanwantri. Lord Dhanwantri is the chief propagator of Ayurveda, and the main, you can say, the god of Ayurveda. Namami Dhanvantarimadhidevam Sura Surairvanditapad Padmam Loke Jararu Bhayamrutyunasham Dhataramisham Vividhoshadhima. This is Lord Dhanwantri. As you can see, if you know a bit about the Indian history, about the context from which Lord Dhanwantri originated, it's the Samudra Manthan, right? There were demons and there were gods on one side. They churned the ocean, and from the ocean came many different, very important things. In that came goddess Lakshmi. In that came different types of gems out of the world. Then there came the pot filled with poison, and that poison was taken over by Lord Shiva into his throat, and that is why we call him Neelkant, right? Because of the poison, the whole throat became blue. So, and finally, out of that ocean churning came the pot of ambrosia, through which humans or living beings would live eternally. And that pot, basically, you can see on the right upper hand of Lord Dhanwantri. And it was Lord Dhanwantri who brought that pot out of the ocean, basically, or originated along with Lord Dhanwantri. So that is the importance or mythological importance of Lord Dhanwantri into that context. But this is basically a story about the origin of diseases in the world. There's a scientific part to this, where in Ayurveda it is said that across the world there were different diseases being originated in the world. Many people were dying at a very early age. Many people were suffering from different kinds of diseases and ailments. And so during those days, there were thought-provoking people. There were scientists, basically, into the form of gurus, into the form of scriptures, into the form of religious preachers. And all of these intellectual people came together, thought for solutions, and finally came up with this science of life, that is Ayurveda. And it not just believes into treating people, but it also takes care of the prevention of diseases, prevention of many, many diseases of the world, and living a very healthy lifestyle. There are 4 pursuits of human life, basically, that we call. These are dharma. That means the righteous behavior. What you should do as a human being is your dharma. What you should do as a doctor is your dharma. What you should do as an engineer rightfully is your dharma. So that is dharma. Second comes earth. To fulfill the various aspects of life, of human life, you need certain monetary, you can say, support, or it may be contact supports as well. So any kind of support to support your life in this world. So that is earth. Then comes calm. Then, because you are a human, you will have certain type of desires. These desires are also very necessary part of humans, right? So that is calm. And finally, as a human being, you have to work for that final aim, that is moksha or nirvana, or you can say you don't have to take birth into this world where you suffer a lot as a human being. So that is moksha, or you can say achieving the oneness with God. So that is your final aim. But until and unless you follow your dharma, earth, and calm, you are never going to reach to your moksha. So to reach to that place, to have all these 3 pursuits, all these 4 pursuits fulfilled in your life as a human being, the most important thing is your mental and physical health. Because if you don't have mental and physical health, you are never going to achieve these 4 pursuits of humans. So we are going to talk today about Panchakarma. which is a part of Ayurveda. It is a part of Ayurvedic treatment, both for prevention of diseases and for curing of various ailments. As Gauriji was talking about, there are many different chronic disorders which can be managed and cured in much better and much faster way through Panchakarma. The first image that you can see here shows you a very basic thing about Ayurveda. And if you understand this image, you understand everything about Ayurveda. Uh, Ayurveda says everything in this world, everything in this universe is made out of five basic elements. These five basic elements are ether or space, basically. We call it as Akash Mahabhut. It signifies hollowness, it signifies emptiness. So wherever there is empty space without anything, it can be called as Akash Mahabhut, or the Akash or the ether element. So any empty hollow space that you can imagine into the universe, into our body, is dominated by Akash Mahabhut. That is the first thing that you have to understand. The second Mahabhut, or the second element of this universe, is air, or the Vayu Mahabhut. So wherever there is any movement, the planetary movements, movement of my body, movement of my limbs, my speech, because it's a movement of various organs and substances in my body. So that is air. So any movement that you can imagine, you will have to understand that it is being moved by the Vayu Mahabhut. Then the third Mahabhut, or the third element, is fire, or Agni Mahabhut. Any transformation that happens, fruits get ripe from raw form, is because of the fire. It is the fire which transforms. It is the energy that comes from the sun which makes the plant create fruits in them, which makes the plant create food for itself. So that is the fire of the universe, and the fire of the body is the digestive system of our body, or the metabolism of our system. So that is fire, or Agni Mahabhut. Then the water element, or the Jal Mahabhut, anything in this universe, anything in our body which is into liquid nature, which is in liquid state, is basically Jal Mahabhut. And finally, the fifth element is the earth. Now, earth doesn't signify just the land or the earth, but it signifies anything which is solid, anything which is densely packed with cells, which doesn't have a lot of space in it, which is hard, which is heavy. So that is earth. So you can imagine our bones, organs of our body, which are densely packed muscular organs, or any cells densely packed, is basically the earth, or the Prithvi Mahabhut in our body, and the universe as well. And Ayurveda believes into this system where universe is similar to the human, and human is similar to the universe, because they are all made up of these five elements, that is Akash, Vayu, Agni, Jal, and Prithvi. So everything in this body, as I told you, you can imagine anything in our body as well, are made up of these five elements. But what comes here is, you cannot find these things specifically into a pure form. You cannot find ether into a pure form. There cannot be any solo space, hollow space, where there's no air, or where there's no light, or where there's no water, right? That is why these are ideal elements. But for them to function into our body, they have to be in combinations. And through these things comes the system, or the science of dosha in the human body, which we call as the humors of the body. These are Vat, Pitta, and Kapha. You might have heard about these words, right? But these are basically the physiological basis of the body. The ether and the air, the Akash and the Vayu Mahabhut, combine to form the Vata dosha. So that means anywhere in our body where there's a hollow space, along with some kind of movement, it is because of the Vata dosha. So my body moving is basically because of the vata dosha. My intestines, basically, which is a hollow organ, but there's a transport of hormones, transport of enzymes, transport of tissues, transport of the food is basically dominated by vata dosha, right? Then comes the pitta dosha, which is a combination of fire and water. So any liquid which is hot in potency into our body is pitta dosha, right? So any metabolism, all the liquid secretions in our body, the hormones into our body, the digestive juices into our body, the liquid HCl into our body, the acid that we call into our body, everything of this is hot and liquid. Even the blood in our body is liquid, but it is hot. So that is also related to the pitta dosha. Or basically, you can say the metabolism in our body is being ruled or generated or dominated by pitta dosha. And finally comes the kapha dosha. Kapha is a combination of earth and water, the heaviest of elements. It signifies nourishment. So anywhere in our body, because it needs replenishing, it needs nourishment. So that is why kapha dosha basically replenishes, it nourishes your body. And that is the kapha dosha, which nourishes the whole body. So these are three systems, basically, three basic physiological functions in our body. And we need to have all Vat, Pitta, and Kapha in our life to sustain, to survive, and to live. I hope this is clear. This is a very short introduction, but still, you have to understand the subtleness of Ayurveda, how it works, and how it defines the body. Because this is how Ayurveda treats and also manages and also prevents diseases. Now, according to Ayurveda, we say that there's a definition of health according to Ayurveda. This is samadosha, samagnischa, samadhatu malhakriya, prasannatmendriya mana, swastiti bhidhiyate. You know, Ayurveda is completely written into Sanskrit, and most of these shlokas are into poem forms, or its poetic version of the medical science, basically, right? So it says that everything in our life should be in balance. The first thing that you know, we talked about the physiological basis or the humors of life, the Vat, Pitta, and Kapha, they should be in balance into your life, because if they are not in balance, then they will create diseases in your body. Then comes Agni, or the digestive fire in your body, because digestion plays a very important role according to Ayurveda. So even that should be in good condition. You should not be able to digest anything absolutely fine, so that nothing, no important thing can be absorbed into your body. Or you should not be in a condition where you cannot digest anything, because in that condition as well, the body won't be able to absorb anything, and the food that you consume becomes useless for you. So the Agni should also be into balance. Then comes various tissues of the body, which we call as dhatus, because your body is made up of different tissues, different cells. Even they should be in balance, because if there is difference, we say obesity, I am obese, because the amount of fat into our body is exaggerated or increased, which is not good for our body. So even that should be in balance. So fat or lipid is basically a tissue of the body. And that is why the dhatus must be into samavastha or in balance. Then the mala, the waste materials that are created from the body, should also be good. Even if you say you don't pass stools, that means there is some problem with your body. Even if you pass a lot of stools, even that is not good. So even that should be in balance. So these are the balance of mala. And Ayurveda talks about the mental aspects also, that you should be satisfied or happy. Your soul should be satisfied or happy. Your indriya, your sense organs must be satisfied or happy. And your man, your mind, your subconscious mind basically should also be satisfied or happy. Because if these three are not satisfied or happy, even then you are not into a state of health, but there is some disease creation happening in your body. So that is how deep the definition of health in Ayurveda is. So now let's see our today's topic based on all these things, because Vat, Pitta, Kapha will always remain the basics of anything in Ayurveda. All the five elements, the Panch Mahabhut will always remain the basics into Ayurveda, right? So we are going to talk about the Panchakarma therapies. You might have heard about this. You might have known into various contexts. You know that there are massages, there are treatments like Shirodhara, and they are relaxation therapies or treatments. But I'm going to teach you what basically Panchakarma means into Ayurveda, right? So these are the five basic therapies that you can see on the screen. The first one at the center is Vamana. Now, Vaman basically is where we make you vomit out things. So I'm going to explain you how this works, for what it works. But Vaman is the first therapy, which is therapeutic emesis. So basically making you vomit out toxins from your body. It's kind of a biopurification of the body. The second comes the Virechana. Virechan is therapeutic purgation. So here we give you medications and treatments so that you purge out the toxins and harmful material from your body. So that's Virechan. How it works, on what dosha it works, we are going to see it today. Then the Rakta Mokshana, or bloodletting. Many times we say that your blood is impure and you need to remove certain part of blood. That is also related to a dosha. So we are going to see that that is also one of the Panchakarma therapies. Then comes the Nasya, or instilling medicated herbs, instilling medicated oils, ghee, powders into your nose, because we say Nasahi Shirasodhwaram. That means your nose is the gateway to your head. So basically, if we want to work on your whole head, onto your sense organs, onto your brain, the best route is Nasya, or instilling medications into your nostrils. Then comes Vasti, or Basti Chikitsa, which is medicated enema. It is very good for Vata dosha and very good for diseases like paralysis, movement restrictions, and many other digestive system and brain related issues, nervous system related issues. We are going to talk about all these things. And also now you would be imagining, oh, I was always thinking about Panchakarma as a massage or an oil massage or some sudation, basically fomentation therapies, the sauna, the spa. But doctor didn't tell about any of these into Panchakarma. Panchakarma basically means a set of 5 therapies, right? And these are the 5 therapies that we saw just now, which, or the combination of which, is known as Panchakarma. And one more thing is that out of these, maybe only one out of these is suitable for your body, and we would only do one therapy for you. So that is how Panchakarma works. That is how the detoxification of Ayurveda, or the biopurification of Ayurveda, which is a better word than detoxification, works into Ayurveda. Now, whenever we talk about medical science, whenever we talk about a doctor, basically, as a patient goes to the doctor with a particular set of complaints related to a disease that the patient may be suffering from, then there can be various different modalities through which treatment can be done, right? So out of these, the first, Ayurveda classifies these into 2 types, which are Shaman and Shodhan. Shaman basically means the palliation therapy. So when a patient comes to an Ayurvedic doctor, the Ayurvedic doctor checks, diagnoses the patient, and classifies that which dosha has increased or has been vitiated into the patient's body. And depending on that, if the dosha is not vitiated too much, it's in moderation, and it can be cured just with oral medications or external applications, then the first modality of treatment that comes is the shaman, or the palliation therapy. So basically what we do is, if the doshas are not vitiated a lot and they are not creating very serious effects into the body, then we would treat that medications, treat that patient or disease with herbal medication, herbo mineral medications, or oral medications or external therapies alone. So we are not cleansing or removing out anything from the body in that condition, which is oral medicines, which can be tablets, capsules, liquid medications, different types of ghee, different types of oils, and all these things, right? So that is shaman or palliation therapy. And now comes the thing that we are here to know about, that is shodhana or purification or biopurification, right? Now, shodhan is needed or has to be done when the doshas in your body are increased up to very severe extent, where nothing can be done just by giving oral medications. The disease is not getting cured. In that case, we have to opt for the shodhan or the biopurification, or removing out the excess of doshas out of the body. And for that, we use this modality of Ayurveda, which is known as Panchakarma therapies. So, depending on which dosha in your body is increased and which dosha, excess dosha, I want to remove out from your body, I would select one of these 5 therapies and treat you. Now, what are the objectives of this Panchkarma? These objectives, as I say in Ayurveda, we always say, swasthasya swastha rakshanam aturasya vikara prashamanam cha. That means we are here to create a condition of health and wellness into people who are not diseased. So we are basically here to maintain the health of the healthy. And finally, if someone has a disease, then we are here to eliminate the disease out of human's body. So, swasthasya swastha rakshanam, preventing the health of the healthy, and aturasya vikara prashamanam, and treating the disease of the diseased patient is the prime objective of Ayurveda. And similarly, this is also the objective of Panchakarma in Ayurveda. Now, what can Panchakarma help in cases of health maintenance? So, for health maintenance, there are various kinds of Panchakarma which can be done into our day-to-day life or according to the season that we are facing. Because many times, with changing of season, with changing of time, with changing of environment or situation around us, we fall prey to various kinds of diseases. And to prevent ourselves from those diseases, there are certain basic panchkarmas which can be done. We'll talk about that as well. But the main important thing into that prevention aspect of panchkarma is that many times in various seasons, you might have seen that as soon as the spring comes, you see a lot of pollen allergy, you see a lot of allergic bronchitis, allergic rhinitis, all these issues. Suddenly there are breathing difficulty cases, suddenly there's heaviness of the body, suddenly there's puffiness of the face, everything of this happening into spring. Now, why does this happen? This happens because the kapha dosha, we talked about kapha, the heaviness, the earth and the water element are dominated into that season. And so that season creates various ailments related to kapha dosha, which is basically heaviness, breathing system related problems, recurrent cough problems, sinusitis issues, and these things, basically these allergies or these diseases, that kind of diseases happens more often during the spring season. So as soon as this season comes, you would hear people saying, oh, as soon as the spring comes, I start sneezing. I have a lot of secretions coming out from my nose, a lot of secretions coming out of my mouth. That is because it is the time which is dominated by kapha dosha. And so during this season, even if you are healthy, you must undergo Vaman treatment or the therapeutic emesis, the induced emesis during this time, because it naturally increases even for healthy people. And if you remove this throughout the year, you won't have problems related to heaviness, related to excess mucus secretion in your body, So this is a way of seasonal purification. So during the spring, we undergo Vaman or therapeutic emesis, where we make patients vomit out excess of kapha out of their body. Then during the monsoon, basically when it's raining, when it's cloudy, the vata increases in your body. So you see many things like dryness of the body, you see many pains, different kinds of arthritis pains, different kind of body aches starting in your body during monsoon or during the cloudy season. And that is the time when vata increases in your body. Even though it's moist outside, but it's dry inside. And that is why vata is increasing inside your body. And to balance this out, basti or medicated enema of Ayurveda, this is quite different from the saltwater enema or the water enema or anything that you know of. This is medicated enema. It includes oils, it includes honey, it includes various materials, medicated substances into this. So it's a completely different way, but it is the best way to balance your vata. Then during the autumn season, basically, the sun finds extreme intensity. It is the pitta season, when the pitta in your body increases and you face problems like anger, irritation, burning sensation of the body, various inflammations in the body. And that is the time when virechana or therapeutic or induced purgation is advised according to Ayurveda. So during this time, every one of us should undergo virechana. These seasonal purification are a bit milder than the originally intended Panchakarma therapies, but still these are very, very important. And if you undergo these seasonal purification, biopurification, then you are sure to be prevented from most of the diseases that you can face throughout the year. That is why it is said that these seasonal Panchakarma therapies are extremely important. What is Vaman, what is Virech, what is Basti, we are going to learn in detail as well. So I'm not talking about it here, but depending on the movement of Earth around the sun, the seasons change, and so does the environment change. And so our eating habits, our diet and lifestyle should also change. And we also need to balance or regulate the changing doshas in our body. And for that, the Panchakarma therapies help us. So even for healthy people, Panchakarma is advisable. And during these seasons, these Panchakarma therapies are advised according to Ayurveda. Now, when we talk about Panchakarma, many times we loosely say it's therapeutic emesis, it's therapeutic purgation, or it's therapeutic enema. But these are not just single individual events or procedures, but it is to be done in a perfect, particular manner. So before the treatment, we have to do certain preparatory actions, which is known as Purva Karma. So, which is before you do the original procedure, we have to prepare your body for that biopurification. So that is known as Purva Karma or preparatory procedures or actions. Then comes the Pradhan Karma or the main action. Here comes the purgation or emesis or enema or nasal instillation of medicines, but you have to prepare your body for that. And after the main procedure is done, even after that, we are not done. After that, we have to be very, very careful, because now your body is absolutely new, like a newborn, and you have to take care of your body so that your body doesn't fall prey to the disease which is removed from your body, which is known as Paschat Karma or post-therapeutic actions. Now, the Purva Karma. So let's learn a bit about the purification or preparatory therapies for purification, right? The first thing, when a patient comes to us and we diagnose the patient and we think that this person or this patient should undergo biopurification or Panchakarma therapy, because the doshas in the body, the disease in the body is not controllable just by oral or external treatments, then the first thing that we would usually do is check for the proper digestion of the body. In Ayurveda, many things depend upon the condition or the status of your digestive system. Because if your digestive system is not good, no matter how good treatment I give you, it is not going to be absorbed by your body and you're not going to be treated properly. So that is why the first prerequisite for doing any biopurification also is the digestive therapy, or improving the digestion of your body, improving the metabolism of your body. Then comes two very basic preparatory procedures, which many people consider in itself as Panchakarma therapies. But these are pre-preparatory procedures or preparatory procedures for the purification or biopurification. These are Snehana. In this, we also give external and internal oleation. So it's like we are making your body smooth. We are anointing your body with oil. We also give things like fat, the ghee or the oil into your body internally. So we usually give ghee, which is clarified butter or purified butter, which we make traditionally according to the Indian systems. And this ghee is given daily into increasing quantity just to prepare your body, just to strengthen your body, just to make the toxins in your body loosen up, come to the center of the body from where it can be removed out of the body. So this is Snehana, where we give internal oleation in the form of ghee or clarified butter. And we also give external oleation into the form of massage. So many times you might have heard, oh, we are going to do Panchakarma on you, and you just get massages and you feel extremely good for your body because someone massaging your body with oil, you certainly feel very, very good because someone's touching, working upon your body, someone's giving you good massage, good hormones are released in your body and you feel much better. So that is also one of the therapies which comes under external oleation therapy, which is Snehana. We call this procedure as Abhyanga, which is oil massage or giving love to your body. So that is Abhyanga, and it is the pre-preparatory procedure for the main purification. Then comes the sudation or steam. So after this massage, we expose you to steam or sudation, which opens up the pores of your body so that the oil that we have applied onto your body externally gets absorbed, because the pores of the body opens up with the heat basically. So that is sudation. And again, you feel extremely light, you feel toxins are going out from the body. But this is Svedana or sudation or fomentation therapy according to Ayurveda, which is Apurva Karma or the preparatory therapy for Panchakarma. Now, what are the main procedures? We have talked about this, the 5 therapies that we talked about into the first slide: the Vamana, the Virechana, the Raktamokshan, the Nasya, and the Basti Chikitsa, right? So first, let's learn about this Vamana, which is the first procedure which comes under Panchakarma therapies. The first procedure is Vaman or therapeutic emesis. You can see into the image. If you are very sensible, I'm really sorry for keeping up the picture, but this is what we do right into the main procedure. So first we prepare your body for creating or bringing the toxins from the periphery of your body into the central portion, that is your stomach or your digestive tract. And from there, we want to remove out. Now, this procedure is Vaman or emesis. And this procedure basically is done to remove excess of kapha out from your body. So whenever you have any heaviness in your body, respiratory system related problems, diseases related to your head. For all these things, Vaman or therapeutic emesis is extremely important procedure. So usually into this procedure, the first 3 days or 5 days or 7 days, depending on your body, we will give you ghee or clarified butter to drink into increasing quantity. So if your body is suitable for a 5 days pre-preparatory procedure, we analyze that, and on the basis of that, first day we may give you 30 ml of ghee, second day 60 ml of ghee, third day 90, fourth day 120, fifth day 150 ml of ghee on empty stomach. So you can understand this is giving a lot of fat into your body, but this creates certain type of fat vesicles or lipid vesicles in your body, a bag of lipids which goes to external or the periphery of your body, and it attracts and removes all the toxins along with it and comes to your stomach. This is scientifically how fats act into your body for biopurification, right? So we give for the first 3 days or 5 days or 7 days ghee into your body, and then we give a 2 days of break where we do oil massages and sedation, so that now everything from the external part has been come to your center of your body, into your digestive tract. And on the day of Vamana, we give certain things, like if you are a bit weaker in your body constitution, then we drink milk or sugar water, sugarcane juice, liquorized tea up to your throat. We ask them to drink absolutely up to full throat capacity. And then we give herbs like madanfal or vacha. Madanfal is Randia dumetorum. This is a type of herb which creates emesis into your body. And Acorus calamus or vacha, which again creates emesis into your body. So depending on your body type, we will give any of these herb to you after giving you to drink milk absolutely up to your neck or your throat. And this will make you vomit out or make you emesis, make you get emesis. So that is how the toxins which have been took to your digestive tract are removed out of your body. This works absolutely wonderful for various treatment modalities. It helps alleviate asthma, cough, recurrent cough and cold, basically asthma, bronchitis, repeated colds, dyspnea, that is difficulty in breathing, nausea, loss of appetite, sinus issues, skin diseases, obesity, diabetes, and all such kapha related problems. So you can understand this is absolutely wonderful biopurification. And we have seen this, that this also works absolutely wonderful into conditions of depression as well. So contraindications, young children should not be exposed to this therapy, elderly people, debilitated or weak patients, patients who have stomach ulcers, trauma to the lungs, heart diseases, abdominal tumors, intestinal obstruction patients should not be subjected to this emesis or therapeutic emesis. Woman, this will be a one-day procedure, the main procedure, right? And on that day, we will give you things to vomit out things, right? Then comes the second procedure, which is the virechana or purgation. So this purgation, basically, you can understand many times we take purgatives because we feel our stools are not getting removed from our body properly, or we are suffering from constipation. But this purgation or this therapeutic purgation is absolutely different from that simple purges that we induce into our body. So this purgation or virechana therapy is mainly used for pitta dosha in your body. So whenever you have any kind of acid regurgitation problems like GERD, that is gastroesophageal reflux disease, you have acidity, you have anger issues, you have irritation, all these things which are pitta dominated conditions. For them, this virechana or therapeutic purgation works absolutely wonderful, right? For this, again, the pre-preparatory therapy includes 3 days or 5 days or 7 days of ghee drinking and 1 day of oil massage and fermentation. After that, here the gap is only of 1 day after the initial 3 days, 5 days, or 7 days of ghee drinking. And on the day of viration, we give you purgatives so that the toxins which have come into your body are removed from the lower root of your body. That is through your anus, through your digestive tract. It cleanses your digestive tract absolutely. It removes any inflammation out of the body. And this is absolutely wonderful. Again, the main procedure is of 1 day where you may have 10 times or 20 times or 30 purges, but it removes absolutely all the toxins and it purifies the body of excess of pitta. So excess of pitta is removed in your body. Chronic skin disorders, in diabetes, in fistulas, hemorrhoids, but these are also the fistulas and hemorrhoids are also to be done very carefully. So I would remove this basically. In cases of liver disorders, ascites, anemia, migraines, asthma, many types of asthma like the bronchial asthma, basically, we do use this, right? Cough, jaundice, liver related disorders, edema, gout, and all other liver disorders. This virechana is absolutely wonderful. If you have anal fissures, anorectal bleeding, anorexia, indigestion, fever, alcoholism, weak person, pregnant women, old age, and children, this therapy should be avoided. But it is absolutely wonderful liver detox thing into your body. So if you have any liver related disorders, any disorder creating any burning sensation into your body, for many autoimmune disorders as well, both these therapies, actually the Vaman and Virechan, works wonderful. Then the third thing comes is the Basti Chikitsa or the medicated Ayurvedic enema. Ayurvedic enema is introduction of medicated materials into your anus directly. This goes directly works onto your gut, onto your digestive tract, lower digestive tract, basically, the large intestine, basically, because that is the place where vata resides. So, in many conditions where vata is the culprit, which can be dryness of skin, which can be excessive, exaggerated movements of the body, or diseases like paralysis, or in conditions where vata has increased, the mental confusion is there, or excess of grief, sadness is there in those conditions as well, which are dominated by Vata dosha. This Basti Chikitsa or medicated enema works wonders. It can be, the site can be into the rectum or the anus, vagina, or the urethra. It depends on the site of the disease as well. But when we talk about the medicated enema, usually we are talking about the anal route of detoxification, basically. So there are different types of basti as well. One which can be for shaman or palliation, where we don't remove out anything out of the body, but it is strengthening the body from within, right? So that is one. But here, when we talk into the context of Panchakarma, we want to remove out excess of doshas out of the body, right? So there are cleansing type of enemas. In this, we basically prepare things along with honey, rock salt, oil, the medicated water, basically, or you can say decoction. In this, we also add fresh paste of herbs. So we combine all these things, make a very homogeneous mixture out of this, and we insert this into the anal canal. because when we insert this into the anal canal, it passes the first pass metabolism. So most of the medicine which gets introduced may be absorbed by the body, and it works much faster than the oral medication. And this is done for vata type of diseases, pain disorders, pain in the abdomen, chest, pelvic region, pain in eyes, ears, legs, headaches, cardiac pains, hemiplegia, facial paralysis, arthritis, osteoporosis, nervous system disorders, amenorrhea, infertility, obstruction of urine stools, flatus. All these conditions are absolute indications for Basti Chikitsa, or the medicated enema of Ayurveda. But it should not be done in condition of indigestion, obstruction, any perforation, any anal tract related, GI tract related disorder, which is creating bleeding into your body, or diarrhea or vomiting, which is already happening. In those conditions, basically, you should avoid it. But otherwise, for all vata related issues, this is absolutely wonderful. It can also be used for people who are extremely tired because of their over physical activities, because this is one of the most strengthening purification therapies in Ayurveda. The herbs, the material that we use into this basti can be different according to various conditions. So this is how basically we insert the medicated mixture into the anal canal. There are different materials through which we insert this also, but it is absolutely wonderful, absolutely safe, and can be used in many chronic and acute disorders, right? Into this, the one that we talked about was about purification. I also talked about strengthening therapies, strengthening medicated enemas. In that, many times we use oil enema. We just insert oil. This oil can be plain sesame oil. This oil can be coconut oil. But mostly in this case, we also use medicated oils or ghee as well. This amount is quite low, like about 100 ml of oil is inserted into this, so that we don't want to remove anything excessively out from the body, but we are providing smoothness into the body. Whenever there is excess of dryness, we can use this type of enema as well. It can be a bit more as well and a bit less as well. But this type of enema is there into the body, and we do it so that it can be retained for about 24 hours or so into the body, right? So this is known as asthapan basti or tel basti, where we don't intend to remove anything out of the body. But the one that we used previously, the Kashai Basti or the Niruh Basti, the amount here can be huge. It can be up to 1 liter of mixture, on an average about 500 ml of liquid, because these days the modern humans cannot tolerate a lot of liquid directly into the anal canal or the anal cavity. That is why we use a bit of lesser dose, but the classical mentioned dose is about 1 liter. While for the oil, when we just use oil, no other mixtures added to it, in that case, it would range on an average about 100 ml. Then comes the fourth therapy, which is known as the Nasya. Now, Nasya, as you can see, this beautiful image where the therapist is instilling oil drops into the nose of the patient. So you can see the patient is lying on the massage table. The neck is elevated a bit so that there's an angle created with the ground. For the nose becomes straight, and we are applying the oil or putting the medicine into the nose. As this is an oil or ghee drops, We can also use powders into conditions, but mostly we use oil or ghee into these conditions. Again, absolutely wonderful for nervous system related issues, with brain related issues, with any sense organ related issues, any say cough and cold sinus related issues. This therapy, basically the nasya therapy, works wonders, right? So nasya is basically the nasal cleansing, because we are talking in context of panchkarma, we want to remove it out. It can also be done as a part of the daily ritual or the daily therapy, but we don't want to remove anything out there, right? So the nose is, as I said, nasa hi shirasodwaram. That means nose is the doorway or gateway to the mind and the sense organs, where the prana or the vital energy is absorbed in the process of breathing. It involves the cleansing of nasal passage by administration of oils or powders or herbal juices or infusions or smoke directly into your nose. Massaging the forehead, face, neck with herbal oils and fermentation are the pre-preparatory therapy. So first we basically massage the oil properly, massage the face, massage the forehead, massage the neck, and with herbal oils and fermentation. And then we give this beautiful therapy of nasal instillation of medicine. The liquid administration and head is tilted back, and the liquid is poured into the nostril, as you saw into the image. After removal of secretions, massage and mild fermentation is done at the end as well, and at the end to clear the throat, because a lot of mucus can go into the throat. So to remove the residual mucus, gargling with warm water and salt or medicated smoke is given, so that no secretion or excess mucus remains stuck to the throat as well. There are different types of nasya, as I told you. The ones which we are talking is the purification or shodhan, which eliminates the dosha. It can be a bit harsh or sharp, so that the secretions are removed out of your nose. Then there are the palliation type, which is basically where we just want to manage or palliate the doshas inside the body. We don't want to remove anything out. And finally, the Brahman, we want to nourish the brain, we want to nourish the sense organs, so that we can do as a part of our day-to-day procedure or the dinacharya. So according to various substances that we use, it can be of using various herbal extracts, oils or milk, in smoke or various herb powders, or when we apply powders into the nose with special apparatus. So it can be of different types. But here what we are talking under the umbrella of Panchakarma basically is the purification type, the first type that we talked about, right? Then comes a wonderful therapy for the eyes. So now this is the therapy which we didn't talk into the original 5 types, right? Remember? So this is very good for the eyes. So here, as you can see into the image, I'll just enlarge the image. Yes, so here, as you can see into the image, there's a wall that has been created with flour and milk, or flour and water, or flour and oil. And this is usually made from sticky powder flour, right? And this wall is created, and in that, medicated ghee is poured over the eye. You have to be extremely careful, so that the sepsis or antisepsis basically is followed, asepsis is followed, because eyes are very delicate. But this therapy is absolutely wonderful for all eye related treatments, especially for children having specs. This is absolutely wonderful. It tonifies the eyes. It is a wonderful therapy where we can nourish the eyes directly externally. It can be used in many different genetic disorders as well, like the various disorders like retinitis pigmentosa, which we call as RP. This works wonderful in those conditions. As I told, in conditions of refractive system, refractive errors, the hypermetropia or the presbyopia, in these conditions also it can be used. So that is netra tarpan treatment in Ayurveda. Then there are various local bastis. We talked about the basti, which is medicated enema, but there are various therapies which are known as local basti. We call it as basti because it is stored into some place. So these are local bastis which we use for the head. This is very good for mental disorders, basically stress related disorders, schizophrenia, ADHD, the attention deficit hyperactivity disorders, anything related to the brain or mental system. This shirobasti, the lower picture that you can see, works wonders for that. Then for arthritis, the basti above the knee, which is known as the Janu basti, is also absolutely wonderful. It works wonders. Then the Rit basti for heart related disorders, this external therapy works wonderful. Again, we are making a floor wall and we are creating a space, and in that we are pouring hot medicated oils, which we believe that can be directly absorbed by that portion or which pacifies the vata dosha. Can be used for backaches as kati basti, as you can see on the top right image. So that is kati basti. These are local bastis, right? Then shirodhara. Now this therapy is also getting absolutely famous these days, right? We all know about this pouring of oil into your head. Absolutely wonderful therapy for stress, for anxiety, for grief, for stress, for headaches, for migraines, for nervous system related issues, for any degenerative disorders of the nervous system. This shirodhara, where we pour medicated oil on the forehead, is absolutely wonderful. So we can use oil into this, we can use plain water as well into this, which can be hot. We can use buttermilk into this, which is known as takridhara. Very good for stress, facial palsy, facial paralysis, headaches, chronic insomnia, sleep disorders, improves memory, dermatitis of the scalp, dandruff, paralysis, other neurological disorders, skin disorders such as eczema, psoriasis, stress related problems, etc. This can be absolutely wonderful, which is shirodhara, or pouring of medicated material onto your forehead. Then comes Rakta Mokshana, which is included into the original 5 therapies, where we remove blood out of the body. This we usually do where there is a generalized skin disorder into your body, or even into some conditions on localized skin disorders into your body. We have different modalities for removing the impure blood out of the body. This can include this therapy, which is the Jaloka Avcharan, or using leeches which suck impure blood out of the body. This is usually used when you have a particular localized psoriasis, localized eczema, or localized irritation, inflammation of the skin. This leech therapy works wonders in those conditions. Then we use Shiraved, or generalized bloodletting, which is the venesection. For that, even the modern donation of blood can be done in that condition. Then there are therapies which are like cupping of the blood, you might have seen, where for localized pain, localized blood impurification, localized inflammation, these therapies are done. So that is how Rakta Mokshana. But because blood is hot and liquid, so you should remember that it is Pitta related disorder. So for any Pitta related skin disorder where there is burning, where there is irritation, where there is hot, warm temperature, for all these conditions, Rakta Mokshana can work wonders. It is the bloodletting therapy, removal of blood out of the body. For many localized pains also, the bloodletting works wonders. Very quick acting, immediately it reduces the pain by say 50%, 70%, or even 80% within just one sitting. Now, these are the therapies which we also know. The Abhyanga on the top left, basically, this is oil massage to the whole body, wellness massage, absolutely wonderful. Then the lower one, the fomentation, exposing the body to steam, basically, so that the pores or the channels of the body are opened, is absolutely wonderful. Both are very good for wellness. And then this therapy that you can see on the top right is basically the Udvartana. Now, this is absolutely wonderful therapy for obesity. Like in Abhyanga, we use oil. Here we use powdered massage. So here we are rubbing powders onto your body. So you can understand the external peripheral fat will be liquefied and will be removed out from the body. So this is absolutely wonderful. Many times patient comes to us, I'm not obese, but my fat into my abdomen is excess. For those conditions also, abdominal udvartan or rubbing of the powder will work wonderful. But there's a subtle difference between the udvartana of uh, udvartana and abhyanga. Basically, these two both are massages, but here we are using oil and from up to down, because we believe when you massage from up to down and in circular motion, clockwise circular motion onto the joints, it nourishes your body. But here, because we want to remove the fat, we are using powders, but the direction is from down to up. So you can see the fingers here, from down to up, because we want to reduce the nourishment. So this Udvartana is absolutely wonderful therapy for obesity, external fat, or things like that. All these therapies are a part of Panchakarma. But the main 5 therapies where we are removing out toxins from the body or the biopurification are the original intended Panchakarma therapies. And these are all supportive therapies, right? And finally, after the procedures are done, we should not leave our body as it is. We should not immediately shift to the normal daily regimen, because if we do that, we are again going to create disease and the disease will come back. And that is why there is a particular time, depending on the amount of purification that has happened. It might be mild purification, moderate purification, and severe drastic purification. Depending on that, for few days, we advise following a particular diet and lifestyle, which is known as Sansarchankram, or basically slowly taking you to your normal diet and lifestyle. Here we give particular type of diet and lifestyle regimen. There are certain rules to follow. You should not travel a lot, you should not laugh a lot, you should not cry a lot, you should not involve into strenuous mental and physical activities, and your diet should not be the normal food that you eat. For few days you are taking just very thin soups. For few days you are taking rice water, rice gruel, then you slowly shift to rice soup or plain things, then you use certain ghee with that, then you can finally, if you are vegetarian or non-vegetarian, depending on that, shifting to simple milder therapies. So that is how the paschat karma works. Because if you, after doing all these therapies which were harsh to your body, if you immediately switch to your normal diet and lifestyle, your diseases will come back to your body. So always remember, not just the main procedures that we do in the form of Vamana or Virechana or Basti or Nasya or the Raktamokshan. But if you don't follow the Paschat Karma, you will lose all the benefits that you got from Panchakarma or the biopurification. So this is basically preventing you from reoccurrence of diseases. And when you follow this diet and lifestyle, you are sure to lead a very good life for following coming years. So that is all about Panchakarma, the pre-preparatory procedures, the procedures, main procedures, and the Paschat Karma, or the following special dietetic procedures. So thank you so much. Thanks to Karunamayi Holistic for giving me this opportunity. Thanks to Gauri Saranji for this class on Panchakarma. And I hope every one of you got something from this biopurification, or it gave you a basic understanding of how Panchakarma in Ayurveda works. Thank you so much. Namaste. If you have any questions, yes, we are open to questions. And over to you, Gauriji.
Yeah, thank you, Dr. Jha. It was a wonderful explanation. I'm getting my Panchakarma done, but I didn't know so much about Panchakarma myself, actually, until now. Now I understand the concepts behind it, like why certain things are happening. So it's actually, there was a lot of wisdom, and definitely I gained a lot of light from this. Anyone has a question for Dr. Jha at this time, they can raise their hands one by one, and then we can ask them to unmute themselves and go ahead and ask the question. Thank you, Ceci. Yes, it was very informative. Anyone has any question? Any comments?
Yes, please, if you can share anything, how we can add on to this, or if you wish to learn more about this. Many times what happens is, because Ayurveda is very vast, and as I told at the start as well, you need to understand about the basic humors of the body, right? You have to understand about the functioning of doshas of your body. You have to have a basic understanding about Ayurveda, and when you have that, you understand this. As Gauriji was telling, when you are undergoing these treatments, it helps you to understand how and why these things are working in your body and how your body is reacting to this. So when you personally go undergo these therapies, then also you'll get a better idea onto this. But yes, we are, along with Karunamayi Holistic, we are planning for more Ayurveda sessions on this. So if you wish to learn more about Ayurveda, if you wish to learn on the basics of Ayurveda, do send in your request to Gauri Saranji, because she is working very hard to design all these courses. So if you want to learn the very basics, we are also planning to do a series of lectures on the basics of Ayurveda. So all of you are most welcome to send in your requests if you wish to learn more about this. Many times you are more interested into a particular disease of yours. Even then, send in your request on that. Maybe we can arrange certain master classes on particular diseases as well. So if you wish to learn more on diabetes, so I'll explain you how diabetes, our body reacts in that condition, what Ayurveda talks about this, or maybe hypertension, the raised blood pressure, maybe it would be stress, maybe it would be mental disorders, maybe it would be ADHD, maybe it would be Parkinson's, or any such disease, because Ayurveda has a very good understanding of all these modern diseases as well. So do let us know if you would be interested into learning the basics of Ayurveda, the diseases according to Ayurveda, the treatment modalities of Ayurveda. We would be very happy to entertain you for that as well. We are also trying to arrange few lectures, as I said, on various of these topics. And I would always be very happy to work with Karunamayi for this.
Thank you, Dr. Jha. Yes, I definitely look forward to more upcoming webinars. And like you said, we might have some workshops also in future in the next coming months. And definitely there will be more webinars coming up as well in the next months. But if anyone has any comment, please go ahead and let us know how you liked the session today and if it was informative for you. Melanie has a question here. She says, are you practicing in India? If so, is there any Ayurvedic doctors you can recommend in Toronto?
Yes, I'm practicing in India. At present, I don't know of any doctor practicing in Toronto, but I think Gauri Saran ji can help you more into this because she's dealing with all these things. Gauri ji is also planning to start with some online consultations on Ayurveda, which can help you preliminary for your conditions. But to be very honest, I don't know of any Ayurvedic doctors working in Toronto. But yes, Gauri ji can help you with that.
Yes, I can try to look for you, Melanie, if you want. I have not yet had any doctors from Toronto on the channel yet, but I can try to look for you if needed. And you're welcome to also take consultation on our platform. Dr. Jha will be on our platform soon as well. And Dr. Shweta, I think you know her, she's already there, as well as Dr. Sona is there. So you're welcome to take consultations from the doctors in India as well, and you can also take consultation from doctors in Toronto. However, one thing I must tell you is that in Canada, it is Panchakarma is not allowed. Yes, that is why we want to make Ayurveda more globalized and more accepted on a global level, so that it's also more controlled, and like we have like good right doctors taking care of Ayurvedic practices, and but Panchkarma is not allowed in Canada. This is why right now I'm getting my Panchkarma done here, because I know once I come back, I might be able to get a massage, but I don't think that it is as intensive as it is here. Where they have everything from Shirodhara to all the different modalities of Panchkarma that you saw. They don't even give that strong of a medicated enema in Canada, or Virechana, purgation. Like you can do it on your own. I did my Virechana on my own when I was in Canada.
Okay, well, that's what I was wondering. And also if an Ayurvedic doctor can successfully diagnose and treat someone online without actually seeing them in person.
Yes, Mel. So we are basically doing that. We have online consultations. Many times there are different modalities or different diagnostic techniques in Ayurveda. Yes, certainly seeing a person for sure would be much better. But in cases where we are far away and there are no options near us, then in that cases these things are required. At present, we do a lot of online consultations for people across the globe, and we are seeing good results in that case as well, because most of these Ayurvedic herbs or the basic Ayurvedic herbs are available in the North America as well, for Canada as well, for US as well. I'm seeing a lot of medicines being available there. So it's the case. So I think you can think on that. And if you wish to have an Ayurvedic consultation or an Ayurvedic treatment, you can go for an online consultation. There's no harm into this. It will help you for sure. And many times we see that there's not much need of the personalized consultation into an in-person consultation. These online consultations are also personalized one-to-one with the doctor. Gauriji with Karunamayi Holistic is already doing that. Now I have also joined with them. So if you wish to do that, you are always welcome to do that. And you can see the difference for yourself. You can experience that as well.
Okay, great. Thank you very much.
Yeah, Dr. Charles will be there on our online consultation platform coming up this week. So if you want, you can book a personalized consultation with him. They're like usually in the consultation, it's one-to-one on the video. So they do see you, they do talk to you and get your entire history. So usually, definitely seeing someone in person makes a big lot of a difference. There's no doubt about it. But I personally found that I went to some Ayurvedic clinics in Canada, but I have not consulted the doctors again because I didn't feel that the wisdom that I found in the doctors who are practicing in India, it was exactly that much. Like they gave me one or two medicines and that's it. Like I felt that I was able to discuss a lot more with the doctors in India. I'm not sure why, but I haven't met all the doctors in Canada or in Toronto myself. So I'm still on my search. If I find, I can let you know, Melanie, about doctors in Toronto. Um, and I think the only thing that a doctor cannot do online is reading the pulse. They cannot do nadi chikitsa, but I'm not sure how much it is needed in terms of like if it is a condition that requires it or doesn't require it completely. So,
Absolutely, absolutely. Nadi Pariksha, the pulse diagnosis basically is a very important part of Ayurveda. But in many cases, it may not be the only modality, or say for that instance, not all diseases, or say just by doing Nadi Pariksha also, you cannot examine things. But yes, certainly it is very important. And we are trained into diagnosing diseases, the condition of dosha, the levels of dosha, the strength of dosha through the Nadi Pariksha. It certainly adds on to the knowledge that we gain about the disease into the patient. But yes, there are many different questions that comes out of this, the Prakriti Parikshan, or things to modify or to exactly understand your basic constitution. And that helps us diagnose diseases as well. So there's always a talk that goes on between the doctor and the patient, basically. And the most sad part in today's modern medical system is that the doctors don't listen to you for a longer time, or they just give you a time of say 1 minute or 2 minutes where you have not even made yourself clear to the doctor on your condition. So what we do into these online consultations is we provide a time of 30 to 40 minutes where we take a detailed history, where we understand your basic body mechanism or your body constitution. We also understand your mental constitution. We make you explain how doshas work in your body, into your system or your disease condition. And then we decide on to the diet and lifestyle. We tell you what diet you have to follow, what you have to avoid, what you have to eat. We also tell you what lifestyle you should follow, what you should not do, what wrong you are doing into your day-to-day life. And then finally comes the part of treatment or herbs. If you wish to take it, we advise you onto that. And then you are free to take that. Then you can come to us for follow-ups as well. And we see that this works wonderful for patients in most of them.
yeah. No, that's right. Like in Canada, I went to two Ayurvedic doctors. One of them didn't check my pulse until I asked them to. So maybe they didn't consider it important for at first, but when it comes to Panchakarma, nobody was willing to do Panchakarma there. Then one lady I called and she said that in Canada, Panchakarma is not legal. And I'm like, okay, it's not allowed. She said that you could do your Virechana yourself, but we cannot give you that heavy of a dose either, like you will get in India in an actual Virechana. So I did my Virechana myself with my aunt, who is an Ayurvedic doctor in India, and I called her and she told me to buy Panchakarma and castor oil, and I bought everything, and then she told me how to do it, and I did it under her guidance. But again, I don't think it was a lot of amount. It was like like 30 ml, 30 grams of ghee per day that I was having. So, but I was like talking to her on a daily basis to let her know how it's going, because I was feeling very weak at the end of 3 days of Virechana, because after detoxification, that heavy of a detoxification, you do feel a lot of weakness in the body. So if a doctor prescribes you uh, anything to do with Panchakarma, then they have to be in touch with you, because I think that it's not right to leave you doing something. And of course, you cannot do at a heavy dose in Canada, because I think that it's not. I don't know, like one of the ladies on the phone told me that it's not allowed, especially medicated enema is not allowed there. You could do some Virechana, which is okay, but that also not in a heavy dose or something. So in that situation, like now it's your call how you plan to do it. I think that even if you take online consultations, I don't think the doctors will give you strong Panchakarma therapy if you're not around them.
Yes, online consultations usually would have the shaman treatment, that is the palliation therapy, the oral medications, the external therapies, that would be more into that. Panchakarma certainly is not very advisable into that condition, even if a milder Panchakarma is advisable. And most of the cases, as I explained today, that most of the cases, it is the extreme level of or extreme chronic condition of the disease where Panchakarma are advised, right? And in other cases, just the palliation or just the oral medication or external therapies are required, which can be done through online advices. But whenever Panchakarma is needed, certainly it is absolutely good to be with the doctor or under the guidance or observation of the doctor, Ayurvedic doctor that you're following.
Yeah, I think like there are certain medicated ghees that you could give in smaller amounts just for palliation or shamana. I think, or snehana, or internal snehana, which is not the real virechana, it's just snehana type thing. Like you're giving some sort of medicated ghee and a little bit of castor oil just for cleansing a detox, which is not real Virechana. That's what the doctor told me there, that, like we can't give you the actual Virechana, but you could do a smaller dose. I think it was probably, she was talking like what you said, Snehana and things. That is, that is, all you can do. But even in that situation, I think it is better that if you are consulting a doctor, then you are able to be in touch with them when you're taking any therapy. Or you have a follow-up with them, because like for me, I felt quite weak after 3 days of detox when I did it last year.
It is quite heavy, as I said, and that is why there are many things to be taken care of before the treatment, during the treatment, and after the treatment as well.
Okay. Navina Ji is saying she'll be interested in in-depth sessions, and Navina, we will be having in-depth sessions. Thank you for your request for that. We will be having them. We are planning to host workshops at Dr. Jha in future. There will be these type of webinars that will be coming up on certain health related topics for sure. But also we might, I spoke with Dr. Jha before, that we want to host some sort of courses or workshop sessions for 2 days or 3 days, but those will unfortunately not be free. Webinars are usually free like these, where you could come for an information session. But if there'll be a workshop for like 2 to 3 days in the weekend with like complete in-depth knowledge from A to Z on certain topic of Ayurveda, that would not be free. Unfortunately, that will because that would take Dr. Jha's my time and resources and everything to create a proper program for everyone to understand something in full detail. But we will be planning those workshops out too in the future. We want to definitely keep spreading this awareness through webinars for free for sure every month. So that this is also a service that people are getting to know about Ayurveda on a generalized way, what it is about. They get interested, and then if they want, they can learn a lot more, or they can try to go on their own journey with Ayurveda, with an Ayurvedic doctor, or with whichever route they choose to go through. But definitely we will continue to keep sharing this wisdom through webinars as a service. But in future, we will also host workshops and courses that will be way more detailed from A to Z on a particular topic of Ayurveda, whether it is the essential basics of Ayurveda, or it is the whole of Panchakarma, or Ayurvedic diagnostics, or Ayurvedic nutrition. We will be creating such workshops and courses very specific, or Ayurvedic Dincharya, Ritucharya, and all that concept. We will definitely have more detailed uh, uh, workshop sessions and courses for sure. So,
Thanks, Gauri, for that. And thank you, Dr. Jha. I was just wondering, what is the best way to contact Dr. Jha for a
we will be
personalized
having him. We will be
consultation?
having him for a personalized consultation on our platform by this coming week.
Okay.
So I can send you, since I have your email now, I can send you the email in the email the link for consulting him directly in this coming next week.
Okay, sounds great. Thank you for organizing this webinar. You know, it's really informative.
Thank you. I'm glad that you liked it. Thank you, Melanie. I'm glad that you liked the sessions. If any other questions you guys have related to the webinar and the classes, then let me know. Or today's session, any comments? Simran and Seti, are there any comments from you guys? I think they're okay. They don't have a comment. Well, I hope you all enjoyed the sessions, and if there is no more questions, then we will end the session for today, and we will definitely be back. If there's any suggestion for next webinar, then please let us know. We can have a generalized discussion on that particular topic that may be of interest to you. Please let us know if there's anything. Melanie, Navina, Ceci, Simran, if you guys, any of you have any suggestions, you can let us know today.
Well, the most thing for me is, as being a woman, it's basically weight loss, and I need to lose some weight, a lot of weight. And I'm becoming prone to dry skin, which is super weird. But I feel that my skin is becoming more drier and drier. I live in Michigan, by the way, so that also contributes, I guess, to a certain extent.
I think
so although you try to apply topical moisturizers, it doesn't really create that glow which you had, you know. That's what I think I lost that glow.
I think that's a thing. That's a thing we can cover with Dr. Jha in the next webinar. Maybe we could cover something on skin, Ayurveda for skin allergies, or for maybe. I'm not sure if you could even cover psoriasis in that. Psoriasis, skin allergies, and dryness of skin. All skin-related ailments.
Yes, so we can keep one on autoimmune disorders where we talk about psoriasis, SLE, systemic lupus erythematosus, or things like that. And on the other hand, a generalized skin disorder webinar, or even related to obesity, so that we can do.
Okay, so we could do one on skin skin disorders for next time, and then we could do on obesity again. Melanie has said that she wants to do something on physical and emotional balance. So we could do that in the upcoming sessions as well. I think next one we could do it on skin disorders as we decided, and after that we could do something with emotional and physical health
Absolutely.
with Ayurveda and how it looks at it, because Ayurveda is holistic. It's not just physical, it's
Right.
mental, spiritual, everything in there. So for sure we can do that in the upcoming webinars. Anything else anyone has to say? Well, if everyone is okay today, then we will be ending the session for today. Thank you so much, Dr. Jha, for a highly enlightening session on Panchakarma and educating us all about this ancient methodology of healing and detoxification. And I look forward to our next webinar on skin disorders coming up with you very soon. Thank you.
Thank you. Thank you so much, Gauriji. Thank you everyone for joining in. Namaste.
Thank you.
Have a nice day.
Thank you. Namaste.
Thank you.